Welcome to this EAUN edition of the EAU podcast. In this episode, we are delighted to be joined by Jeannette Verkerk, Phil Reynolds, and Mariet Lenaers. Together, they discuss the first EAUN hands-on training in erectile dysfunction, which took place during EAUN 26 in London. Join us as we embark on this informative journey.
Welcome to this podcast. My name is Jeannette Verkerk and I'm here with Phil Reynolds and with Mariet Lenaers. We're here as a special interest group from sexual health from the EAUN at the EAUN Congress in 2026. And as special interest group, we organize a lot of things. For example, a HOT. And we want to discuss the hands-on training. We had this Congress on last Friday. You've been also present at the hands-on training and did a presentation. Can you tell me something about it?
Yeah, so it was a great session, well attended. Seems to have gone very well. We spoke, obviously, my specialty was talking about communication and involving patients, but also their partners in discussing their sexual health and how to sort of initiate conversations for those healthcare professionals who perhaps are a little timid, a little shy, don't really know how to start these conversations because it can be a bit taboo for some people. They haven't necessarily had training in their, when they've been studying and how to approach these conversations. So that was what I was looking at, giving people sort of talking about open questions and making sure that the patients have a comfortable space to talk in. And that, obviously a partner is very much involved in the discussions as well.
And my presentation was about the penile implants. So the importance of a nurse to counsel, because when nurses are counseling patients before surgery, they will get a better expectation on what to expect. So that was one of my topics, but also the different penile implants that they are, the malleable versus the inflatable one, stuff like that.
That's wonderful, because it's this hands-on training, as you can... You told us already it's about sexual dysfunction. And I also had a presentation on that's hands-on training on the causes of erectile dysfunction, all kind of causes also done by the urologist with a radical prostatectomy, for example. And we also had some working stations where we showed the penile implants, showed the vacuum devices, which are also an important device to rehabilitate the sexual function in people or use it for getting an erection.
I think the pump's very underestimated.
Yeah.
And it puts a lot of people off when you talk about it and when you see it. So again, it's about trying to introduce it in the right way so patients aren't scared by it. You show them this thing and they, what's that? But actually, they understand it's about rehabilitation and almost like going to the gym. If you make the muscles strong, keep the blood flowing around the penis, then it helps your sexual function. So, again, it was a learning thing for everybody. I learned a lot on both of your sessions.
And again, information is key, I think, if you take the time to educate your patient and to explain why it is important that he does the rehabilitation or things like that. I think that is really important. So it was really interesting.
Yeah. Certainly talking to patients when you start a conversation, explain them. I think that's also the main part of the assessments when you're in your outpatient clinic with the patients. Not so much as the tools you have or the questionnaires. You have to talk to them. You have to talk with them. Yeah. Ask them a lot of things, but they also, when you get your information, you can also counsel them in the psychosocial parts.
Yeah.
Also as a urology nurse.
Yeah, and I think both your talks introduce that it's about normalizing it and actually saying there's lots of reasons these things can happen. And you're not the only one that's struggling with it. You talked about your patients 21 to 80, the age range of having these implants, and it's massive. And you don't think about all the causes. And the etiologies that you talked about, some of them had never even thought about causing the problems. So I think certainly I found it useful as a learning curve for me.
And I think it was also wonderful at the hands-on training that they had some discussion based on cases with the audience, with the representatives about what can you do? What would you do with a case like this? How would you talk to your patient? What would you advise your patients to do? And I was with one of the honor sessions at the urologist, and they also said, even if you have about 5 years an erectile dysfunction, almost no erection left, and you want to regain it, then even a vacuum device can help to increase the blood flow, reduce the fibrosis maybe a little bit, and after that PDE5 inhibitors maybe help even better than when you start with PDE5 inhibitors. That was for me an eye-opening from another session, but also very interesting.
Yeah. I think for the participants as well, it was really interesting to know what we do as nurses, to see that. As a urologist, for example, they told me it's really special, or it's really interesting what you are doing, and you have a lot of knowledge about the implants, and so you are in an ideal position to teach them how to use the device, because the surgical procedure is one thing, and then you have to follow up them to get a good patient satisfaction. So this was the perfect opportunity to show them what our role is in follow up or in guiding patients. So
absolutely, because we're the ones that see the patients more than anybody else, probably.
Yeah, they don't have time to do all that work, so it's good to show them what we can do for them as well. Also to other nurses to see how they can improve their practice as well. So I think it was a really success.
Yes, and it's good to spread the word on andrology, on sexual dysfunction, because it's still underestimated subject, difficult to talk, especially for patients. Also for nurses.
Sexual health is also difficult for them to discuss. They avoid the topic.
Yeah, absolutely.
That's why we want to spread the words.
Yeah, and the more you do it, the better it will get, or the easier it will be to talk about sexual health.
Yeah.
And that's why the Plastic model is important.
Yeah, therefore your presentation was great.
Well, thank you.
To get tools.
Yeah, it was just simple things that I've used in my own clinics, and you pick it up as you go along.
But it's really helpful.
So it's about starting the conversation. For the patient, you can see in the patient's eyes sometimes that they want to talk about it, and they don't quite know how to start the conversation.
And they want us to start a conversation.
Yeah.
So,
And we hope to do the hands-on training next year again during the Congress. So hopefully a lot of nurses will attend, of course, and spread the discussion, spread the news, and discuss with each other.
Good idea.
And as for the sexual health special interest group, we also do other things, of course, within the EAUN. We have the webinars once a year. We've had a webinar on the hypergonadism previously, and we will have several webinars coming up, hopefully, on the sexual dysfunction. And we just discussed it. For example, with the catheter, because people have an indwelling catheter. It's also difficult with than having sex.
Is it possible to have intercourse with an indwelling catheter?
Yeah, there's a lot of
Patients don't even know it.
Body image.
Yeah,
whether that's a catheter or you put on weights with your hormone treatments.
Yeah.
So all of these things need to be open to discussion and people not to be scared about it. Yeah, there's lots happening.
Yeah, there's a lot happening. We have a lot of ideas of doing sessions and doing webinars. I think it's a wonderful field to work in the sexual health.
Yeah, I think because it covers, obviously for myself, I specialise in prostate cancer, but so I don't really think about the benign causes of sexual problems. And so for me, it was great. It opened my eyes. But it also made me realise that lots of my patients do come in with problems already. Yeah. Now I have some tools that can help as well. So these hot courses are fantastic.
I think this is a wonderful way to spread the words, and let's keep on doing this with the webinars every year through the EAUN and with the sessions in the Congress.
Indeed. And I'm guessing you'd like more people to join the SIG as well. Always looking for new members.
At least one new member for this year started already.
Yeah.
Chris. And maybe someone from Belgium also wants. This is a wonderful way to go on, and I think it's good to end this podcast with these words. Thank you.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on the urological advancements, be sure to subscribe to our EAU podcast channel on your favourite podcast app. Until next time, keep learning and stay inspired.